Let me show you something that changed how I think about treatment for lung cancer. I'm Dr. James Wilson, a lung cancer specialist. This is a lung cancer radiotherapy plan. You'll see that the colour on the scan is the radiation. Most of the radiation is centred on the lung cancer, but you'll see that there's lots of the normal parts of the body that are being exposed to radiation too. Now the thing in the middle of the chest with the red line around it, that's the heart. Look at all the radiation that's going there. This is a proton beam plan. Just look at the difference. The evidence is still emerging. The randomised clinical trials haven't reported yet, but the physics is undeniable. Protons delivers less radiation to the heart, the normal lungs, the spinal cord and the esophagus. So as a lung cancer specialist, if I had lung cancer today with a tumour next to my heart, if I had pre-existing heart disease, it's a no-brainer. I'd choose to have proton beam therapy for my treatment. It's not available everywhere, but I'd be prepared to pay for it. I'm that convinced of its potential benefits. Sometimes you don't need to wait for all of the evidence, the pictures are so clear. I often get referred patients who've been told that they can't have treatment for lung cancer. One of the questions you should ask is proton beam therapy suitable for me? Now I think there are 5 groups of people who are most likely to benefit from protons. 1, if you've been told that standard radiotherapy is too high risk. The second group are people who've had radiotherapy before. It doesn't have to be for lung cancer. You might have had breast cancer or lymphoma in the past, and now you've got a lung cancer and standard radiotherapy just isn't an option. The third group of people who are most likely to benefit are those with a tumour in the complex location. So if your lung cancer is right next to the spinal cord or it's right next to the heart, ask if you'd benefit from proton beam therapy. The fourth group of people most likely to benefit are those with pre-existing heart disease or poor lung function that excludes them from standard radiotherapy. The fifth group of people that are referred to me are where a standard radiotherapy plan has been attempted, but it just hasn't been possible to produce a safe plan. Protons might be the answer. In my practice, I see it time and time again where protons make the impossible possible. And just if it's not available on the NHS, doesn't mean it's not the right option for you. If you've got lung cancer, there's a potential risk to your heart from treatment that isn't always talked about. Now that might sound really scary, but please remember that radiotherapy is a very effective treatment for lung cancer. But we can't ignore the evidence. There was a landmark clinical trial called RTOG0617. In that clinical trial, we expected the people who got a higher radiation dose for their lung cancer to do better. But in fact, the opposite was true. People who had a lower radiation dose lived for longer. So why was that? When we looked in detail at that clinical trial, we saw that radiotherapy dose to the heart was an independent predictor of a patient's survival. We can't ignore that data. We've had it for years. And time again, clinical trial data and single institution reviews of their own patient outcomes tell us that radiation dose to the heart is just bad news. Serious cardiac events like heart attacks or arrhythmias are all too common in the first couple of years after radiotherapy for lung cancer. So what are we going to do about it? Well, the technology already exists to reduce heart dose during radiotherapy for lung cancer. You may have seen me talk previously about how proton beam therapy compared to standard radiotherapy markedly reduces the radiation dose to the heart. Yes, really good quality cardiology care matters. There are cardio-oncologists, cardiologists with a special interest in people who are having treatment for cancer who can help. All of my patients who have a tumour close to their heart meet with a cardiologist, count on all of their other risk factors for heart disease to be optimised and improved upon even before we started the radiotherapy. If proton beam's not been discussed with you, ask why not. If you're looking for clarity and want to explore your options, I'm always here.